Hi, I'm Ruth Lockhart, Executive Director of Mabel Wadsworth Women's Health Center in Bangor. One of the many services that we offer here is a colposcopy clinic, and we also offer education about women's health issues. So we decided we'd go to a local university and find out just how much young women know about their health. We asked them 4 basic questions.
So what is a pap smear?
A pap smear is when you go to your doctor's office and they take tissue from your cervix and test it to see if you might have cancer or not.
I don't really know. I know that at my doctor's office you get them after you become sexually active because they're looking for cellular changes in your body and your female parts.
When they crank your vagina open and swivel it out, take some samples of your tissue and send it off to get analyzed.
It's when you go to the doctor's office and they take a little sample of your insides, I guess, to test for AIDS, diseases altogether.
So what is a pap smear?
A pap smear is a very basic sampling of cervical cells with a brush, and then we send it off to the lab for analysis. It's a very quick process, and it doesn't hurt. It takes a matter of seconds, and it's usually part of your annual exam.
Do you know what happens if you were to have an abnormal pap smear?
I don't know. They would call you back and do further testing.
Okay.
Probably the doctors would call you back and ask you to come in for further testing. Probably have to go in for more testing for different stuff. Whatever is wrong with you, it depends on what the situation is.
I have absolutely no idea.
If you have an abnormal pap smear, you would have to go and get a follow-up exam. Maybe they take a biopsy. I actually don't know.
So what if the test comes back abnormal?
Depending on the level of abnormality that the test shows, there are a variety of things that we'll do. Anywhere from just repeating the pap smear a few months later to see if it's normal at that point. We may send it out for HPV typing, and we may have to do a colposcopy.
Do you know what the human papillomavirus is?
I do. I believe it's herpes, different forms of herpes.
I don't know if it's an infection or what. It's something that leads to cervical cancer.
HPV is a virus that people can contract that can cause cervical cancer. I am aware.
I don't really know the symptoms or what happens in your body.
Okay.
I know that it's lifelong, like you can't get rid of it and stuff like that, but I don't really know the symptoms or anything like that.
Not know what the human papillomavirus is.
I'm pretty sure it's an STD.
I've heard of it, but I don't have a really good understanding of it.
Virus that causes cervical cancer and different strains of like genital warts and you can get it from unprotected sex, and I think it can lead to cervical cancer, I believe, but sometimes it just goes away. A lot of people have it unaffected.
HPV is the most common sexually transmitted infection in the United States. They're estimating that around 20 million people are infected with it. One reason that HPV is so prevalent is because most people do not have symptoms. A few of the symptoms that you may have are genital warts, and it can also cause cervical cancer.
So how would I get rid of it if I got HPV?
There's actually no cure for HPV. It's something you would live with the rest of your life. It is able to be managed, so there are treatments for HPV or genital warts, but no cure.
Do you know what a colposcopy is?
A what?
A colposcopy.
Colposcopy?
Colposcopy.
I do not. A colposcopy? No.
I have no idea. I've never heard of that before in my life.
No, I have no clue what that is.
No. I have no idea. I do not know what a colposcopy is, but I'm assuming it's some sort of removal of something. No, not a clue.
I think it's when they remove the abnormal cells, maybe.
So once I had a friend who had an abnormal pap smear, and she said she had to have something called a colposcopy.
Yes, a colposcopy is actually a magnified look at those abnormal cervical cells. And when indicated, we'll then take a sampling or a biopsy of those cells.
Okay, so will the colposcopy hurt?
Although uncomfortable, it is very quick and does not require anesthesia.
Well, I hope this information has been helpful, and if you have more questions, call us at Mabel Wadsworth Center or visit us at mabelwadsworth.org.